Hey everybody, this is Tom Hansel from Rxperience podcast here at the annual ASCP Fly-In. Behind me, you see the Capitol building, but we've got pharmacists that have flown in from all over the nation representing their state and representing our industry. They're at the Senate building and the Congressional building, and they've got multiple meetings all day long. Let's watch this podcast to see all the things that they're talking about and critical stuff like PBM reform, IRA, payer status, and so much more. Pay attention to this podcast and see the results of those meetings. Fantastic. This is Tom Hansel with Rxperience, and I'm here with two of our great fly-in candidates, not candidates, what's the right word? Volunteers sacrificing, lobbyists, right?
Lobbyists, engaged members.
And we just had a good meeting with the LA from Deborah Ross's, so I kind of wanted to figure out kind of how that went and what you felt the feedback was when you went and talked about certain issues. Meredith, we'll start with you.
Yeah, I thought it was great. I mean, being a constituent too, and then being willing to come and see the pharmacies that are serving our community is excellent, I think. So.
When it came to all the challenges that we're having, what was the one thing that you felt that they resonated most with them, that they felt like they were on agreement with our position?
I would say the opioid use disorder treatment is pretty much a slam dunk, right? I mean, it just makes sense, and it's not that big of an ask. Some of the other ones with PBM reform or the IRA stopgap, critically important, but it's maybe going to take a little bit more work, but work that's worth doing.
Seemed to be on board with IRA. They understood that. They seemed to be on board with PBM reform. So I felt it was a very positive meeting, and I think we've got a real winner here in Deborah Ross and yeah.
For us in that regard. So definitely thank her as well.
Well, keep joining us at the ASCP Fly-In.
Hi, good morning. I just had the opportunity to meet with the staff at Representative Troy Downing's office and talk to them about PBM reform and access to providers in rural areas like Montana. And they had a lot of great questions about what is long-term care pharmacy, how will the IRA impact seniors getting medications in skilled nursing and assisted living facilities, and also provider status. So able to answer a lot of great questions for them and inform them more about what we do as senior care pharmacists.
This is Tom Hansel from Rxperience, and we're at the ASCP Fly-In, and I'm here with two lovely ladies that have come all the way to help us out.
Hi, I'm Jen Deviney-Lavsa. I'm from Pittsburgh.
Hi, I'm Donna Barnhart, and I'm from Johnstown, Pennsylvania.
So you guys just met with your Pennsylvania representative, or their legal assistant, but tell me a little bit of kind of how that meeting went. What did you guys talk about? What was important that you brought up to make sure they knew?
So during our meeting, we focused a lot on provider status. So that was our key topic that we were trying to articulate to the individual that we met with.
When you say provider status, you're specifically talking about some bills in Congress that's about testing and treating things like flu and RSV and that kind of COVID, obviously.
Right, and we talked about the pharmacist being an untapped resource that can really help with some of the issues that we're facing now, especially in rural America where there are need for access to care. Yeah.
And I'm assuming PBM reform and IRA came up as well. What was their response on that?
So she, definitely perked up when we mentioned PBM, and we thanked for the support, but also articulated that there's certainly more that we need to do. So we did talk a little bit about that, of like the next steps that we can take to improve that.
Right, and we also talked about access to treatment for opioid use disorder as well. So we did talk about a lot of these issues, and she was familiar with them and receptive to them. So.
Fantastic. Well, thank you, ladies. I know you got a lot more meetings to go today, so I appreciate you being here and fighting the good fight. Hey, this is Tom Hansel with Rxperience, standing with two of our great ASCP members that are coming here at the Fly-In, talking to Representative Sparks from Indiana. So tell me about the meeting, kind of how that went.
Yeah, absolutely. So it was great getting out here to DC to meet with the team, with Representative Sparks. We met the Chief of Staff, and we're able to, discuss some of the issues with long-term care pharmacy right now, and especially how it impacts the district here in Indiana. They were very receptive to it, asked a ton of great questions on how these impacts were affecting not only the pharmacies, but the pharmacists, as well as the patients that we take care of. So there's a very great dialogue there. And then also they had their district representatives in today for State of the Union, which was last night. And then from there, we were able to actually have a second discussion with him. So a very engaging experience, with the team here.
Yeah, it's rare to, you mostly talk to the LA, but it's, it's important to be, because you see the representative, talk to the representative. Tell me, when really, PBM is very something that I think everybody kind of knows, everybody kind of accepts. I'm assuming that's the same here, but a little more specific of how like long-term care was affected by IRA. Were you able to get into that, and what was their response to those type of things?
Yeah, somewhat. It was really interesting because we got to do a lot more education on what is long-term care pharmacy, because getting the understanding that it's not like a CVS, it's not like a Walgreens. We've got so many other overhead costs and the packaging, and getting into that really helps paint that picture for them of why this is so important and how that really impacted us in long-term care. And then if something happens to our long-term care pharmacies, there's not anybody to take it over. Right. So just that chain, that domino effect that can happen was really something that we were able to paint that picture. So they were very receptive.
Fantastic. Were you able to cover opioids and, what's going on there as far as provider status and other things like that? Did you have time to get to those issues?
Yeah, we got deep into a lot of the CJS asks we had with a lot of the opioid use disorder rules and kind of how they can help push with DEA to ensure that we can take care of the patients in the facilities that are kind of overlooked at times. So again, a lot of great questions from them on what the impacts are, kind of what the structure is. And they had a lot of knowledge already beforehand on some of the things you said, PBM. They already knew about the IRA. So it made the discussion go a lot smoother than honestly we expected. So fantastic experience.
Any chance that you're going to get Representative Sparks to come to a pharmacy?
Well, yeah, not just a pharmacy. So Dan works in a pharmacy, but I actually work with a group of doctors and nurse practitioners. So we talked about even bringing them into a nursing home so they can see that. So they really get that full aspect of what long-term care is and how we impact all the different stages of taking care of their constituents.
Fantastic. As you can see, we are making a difference here for ASCP, Rxperience at the Fly-In. Thank you, guys.
Thank you.
This is Tom Hansel with Rxperience, and we're here with some ASCP representatives at the Fly-In. And who'd you guys go to see? Who'd you talk to? And what did you talk about?
Okay, well, we just met with Johnny Oshevsky's office. Johnny Oshevsky used to be the executive director of Baltimore County, the chief executive of Baltimore County, and now is a congressman from Maryland. And we had a great meeting with his Health LA, and very receptive to all of our issues.
Yeah, let's dive into a couple of those. So I'm assuming PBM reform might have popped up once or twice. IRA, tell me, what was their responsiveness to that?
So very receptive, and also proud to say that I am a resident of Baltimore County, where Johnny O represents. The conversations went great with his staffer. Very familiar with some of the things that we've been working with, so I think that's promising as well. Barney, share a little more?
We talked about the IRA, that bill. We talked about the appropriations language for MOUD. We talked about provider status, the ECAPS bill. What was the other thing we talked about?
Albeit use.
That was
okay.
the appropriations language. Yeah.
Long-term care pharmacy.
PBM reform.
PBM reform.
Language in there
Thank
as
you.
well.
Because
Yeah.
PBM reform and the IRA implementation, they kind of really meld together.
Yeah.
One supports the other
Yeah.
in terms of why we have the problem we do. Totally understood it, very much on board. I'm very much on board with PBM legislation. They've signed on some other bills that Buddy Carter, one of our members, has introduced. So it was a good meeting. We've had very positive meetings,
Very
actually.
great meetings today.
We've had great staffers in all the meetings, and they really understood. I've been doing this for a long time, so sometimes you have to teach them like what's Medicare and what's Medicaid. And you're starting at there. Others you can actually start talking about issues in depth, and they really understood. It's a pleasure when you get to talk to somebody who has the background already. So,
And most of what we want to change is very bipartisan,
Yes.
supporting about elderly, supporting about outcomes. And so
Yeah.
it's really exciting to be able to walk in to a representative, regardless if they're Democratic or Republican, and get that kind of feedback and support.
And really sharing our perspective as senior care pharmacists and where we represent, educating on some of the things that we do and we see in our practice and in the communities we serve. So exciting time, always fun to get out here during the fly-in and represent ASCP.
Couldn't have said it better myself. Thank you, guys. Fantastic. All right, this is Tom Hansel with Rxperience. I'm out here with two of our ASCP members that have been actively working and talking with senators and congressmen and congresswomen. Tell us who you've seen and who you've been able to talk to so far.
Well, I'd say we haven't seen any congressmen or women or senators, but we've been to their offices.
Fantastic.
So a lot of their legislative aides. But we're the Kentucky and Indiana contingent, so have McConnell, Paul, just came from McGarvey. We've done some duty for some other states as well.
We had a good meeting at McGarvey's office just now that we were coming from. She asked great questions and she was very interested in what we had to say. Talked to her about the supply fee and sorry, you want me to lean in a little bit?
No, you're fine.
And then the opioid use disorder and the ability of long-term care pharmacies to dispense methadone.
So when it came to something like IRA, which is obviously we all are very aware of, we're all very concerned about it, were they aware? Did they see some kind of understanding of the impact IRA is going to have negatively for long-term care?
I feel like we were able to shed additional light for them. I mean, I think they're all aware of the IRA. It's been a big topic, but especially in McGarvey's office.
Yeah, the individuals we've visited have not co-sponsors currently, so I think it was kind of like you could see the light turn on when you start breaking down the unintended consequences of what's happening in long-term care.
Fantastic. Well, thank you guys for doing this, for flying in, taking of your time. It's going to pay off, I believe, in a big way for us. So, buddy, thank you very much for your time.
Thanks so.
Okay, I'm here with more pharmacists that have come in for the fly-in. Tell us who you've all met with, Senate, congressional, LAs, and representatives, and let's start talking a little bit about how the meetings have gone, what you guys have talked about, and kind of the responses that you've had.
Yeah, so far we've met with 3 total, maybe 4. The very first one was very well received. I forgot the names already, but
Give me the state.
The state was Washington State.
Washington,
Yeah. Senator from Washington. It went very well. They're understanding what we're bringing to the table this time, which is not as much. That's not what I've experienced in the past, but so far that's my experience. I don't know about you guys.
Okay, let's go. Yeah. Go ahead, guys. No problem. Small hallways.
Yeah.
That's because we're bringing the noise. All right. So we'll start from there.
I got to meet with the South Dakota, our sole representative in their office, and it was very nice because I have met with her a couple different times, and she goes, I know I need to follow up on that bill, so we're really hoping to get another co-sponsor for HR 5031. And otherwise, the rest of the meetings have gone very well. I feel very prepared after yesterday, so looking forward to a few more visits today.
So when you bring up things like IRA, and do they understand what that impact, the negative impact it's had on pharmacy?
Yeah, I think they do, for the most part, and they're appreciative of the perspective we're taking, which is that we support lower prices, but there's an impact on how we're able to do business and whether we can continue to do that business, and that gets their attention.
Yeah, and unintentional consequences that people that are not in our industry would not have known or felt, but it's severe consequences to long-term care. What about provider status and that kind of conversation? I know that sometimes gets a little freaked out, a few people, depending on who you're talking to. Have you guys mentioned that, and how's that went?
I think generally they receive it well because it's such a narrow scope, and it's been done before, and during the public health emergency. So I think there's people willing to listen to that. I don't think it's controversial from what I've experienced. So
they see the need for that, especially basic stuff. We're talking about flu and COVID and those type of things. What were you gonna say?
Oh, I was just going to say, I think a lot of the folks that we've talked to have already sort of signed on to it anyway.
Yeah.
So it's been a kind of just a thanks for supporting the whole thing. So
Fantastic. Sounds like it's going well. What are you looking forward to the next meeting?
Well, I won't be the primary one talking, so I'm looking forward to that. But I think just continued conversation. I think I'll echo what Bill said. It is really nice. The majority of the individuals we've met with have supported ECAP, so we can kind of end the meeting with a thank you and gratitude, and it leaves with everyone with a smile on their face.
Yeah.
So you think this is making a difference? Well worth doing?
Yeah. And I don't know much about Maine, but I'm pretty sure Bill is the main man. So.
And we'll end with that horrible dad joke.
Hi, I was at the fly-in today. It was a great day, beautiful day in DC. I had the opportunity to meet in person with Representative Tran from California. I met with Senator Cantwell from Washington. I met with Ricketts from Nebraska. I met with Rosen from Nevada. So all over the place, back and forth on the Hill. It was a great day. Everybody was aware of our issues and was open to try to help, and highly recommend.
What you've witnessed today is pharmacists from all over the nation stepping up, not just as providers, but as advocates. These meetings with lawmakers were essential to help shape policies, to help provide and support and protect access for our patients, and to recognize the criticalness that long-term care pharmacies play in today's healthcare. The ASCP Fly-In is where real change happens.